of that food. Victor?
Thank you, Barbara. And let me also thank the panel of the workshop and the IOM staff for the invitation to come and talk about some of the data that we've looked at on NHANES. I'm going to give you various aspects of caffeine intake in America as we've looked at it in the National Health and Nutrition Examination Survey, using what we eat in America, the food and nutrient intake side of that particular survey. I too have a couple of acknowledgments that I need to make. First, I'll give you my agenda. I'll go through some acknowledgments, my disclosures. I'm going to take you through basically 4 different approaches of looking at data that we've had available. Current usual intake of caffeine, and I'll describe what I mean by usual intake in our method slides, looking at both adults and children. Going to also share some data on the current usual intake of caffeine per consumption event, a little different way to look at the data. We've done some trend analysis of caffeine intake over the last decade using the last 5 data sets that have been released by NHANES, and also then take you through some food sources analysis of over that period of time. So just some acknowledgments. My first exposure with caffeine was for the Department of Defense. We did some work looking at adult caffeine intake that we presented at Experimental Biology a couple of years ago. That work is actually working its way through the publication cycle. The more updated work that we're presenting today was supported by the American Beverage Association. Deborah Keast is a colleague of mine, also in Michigan, that helps us look at the food sources analysis. She's one of the country's experts in really digging into the NHANES data sets and was helpful in some of these analyses. My disclosure is I do work for a food and nutrition consulting company. It's my wife's company. Basically, we help food companies, as Barbara said, communicate messages about their products and services, and of late been doing a lot of analysis and publication of data from the National Health and Nutrition Examination Survey. Okay, so let's go through some pieces of what we're going to talk about today. The data source is the National Health and Nutrition Examination Survey. We actually have grouped the studies 2 ways. One for 2007-2010 that gives us a more current look at the intakes, but then also brought in the older surveys when we're looking at a trend analysis data. So you'll see that our ends are very large for the big survey, for over 42,000 subjects, and even for the 2007-2010 data, we have over 17,000 subjects. Because this was something we were looking at, also looking at nutrient intake, we've excluded pregnant and lactating individuals in these analyses. Interestingly, probably could do a separate analysis, but for this purposes, we actually excluded them. Additionally, it's important to know that the caffeine data that we're reporting comes from all foods and beverages, but does not include dietary supplements. As Diane mentioned, really beverages are the primary source. Over 90+% of the caffeine is coming from beverages, but we did include all foods for these analyses. When we did usual intake for the first 2 sections we're going to report, we used the National Cancer Institute method, which here is a reference for you. And just what the usual intake method does is allows us to take the multiple days of intake in NHANES and then to remove the intra-person variation. So therefore, we can actually get a reasonable estimate of a habitual chronic intake. And that's kind of what usual intakes are all about. It's extremely important when looking at percentages of the population above or below numbers, particularly as recommendations, say, for percent of the population below vitamin A intakes. So that's why we use usual intake for some of these analyses. We did that for total population, for consumers, and then for consumption events as well. And we ended up having covariates in those models for recall day and the weekend flag so that we could adjust for any changes that might be associated with weekends. For the trend intake data, we actually used the 1-day intake data because of the way we have to do the trend over time. And we did the same thing for food sources. And for all of our work, we're considering P less than 0.1 significant. These large sample sizes allows us to see very small changes that end up being statistically significant. Since beverages are 90+% of the intake from caffeine, I thought it was important for you to kind of see the beverages that are in NHANES that are included in our analyses. So for coffee, the range is actually 0.4 to 509 milligrams per rack, and rack is actually reference amount customarily consumed. Typically for these beverages, that's right at 8 ounces. But you can see the range in coffee is quite wide. The number one coffee has 95 milligrams. Most frequently consumed coffee has 95 milligrams per ounce, and that's a typical brewed coffee. For tea, the range is 0 to 48, and it includes all hot and tea beverages. This would include herbal teas as well, which would be your zero caffeine. The typical, or the most commonly consumed tea actually has 48 milligrams. It's a standard cup of leaf tea. For soda, the range is 0 to 65 milligrams per rack. This includes all regular reduced calorie and no calorie beverages. The highest consumed soda is a cola type soda, and it's about 20 milligrams per rack. These are the energy drinks that are in Haines analyses, and they range from 45 to 86. And the most frequently consumed energy beverage has 72 milligrams per rack. This gives you a perspective of the data that are available within Haines. So let's take a look at, I'm going to give you data, the first couple of slides will include some data for the total population, and then for consumers only, and we'll be bouncing back and forth on that, and I'll try to point that out for you. Just to orient, we're caffeine consumption per day. These are our age groups that we've used. From 2 to 11 up to 60 plus. And these are mean intakes, mean usual intake for the group. And you can see for 2 to 11, we're about 25 milligrams, get to about 50 in the total population as for adolescents. And then as you get to adults, we get over 150. And in older adults, as Diane mentioned, you actually get above 200 in the total population. If you look at consumers only, this is a very interesting substance, in a sense that if you bounce back and forth, you can see that we have 17,000 total observations in this study, 13,000, and this one went almost 14,000 when you look at consumers only. A lot of the population consumes caffeine. It's a very common substance to be consumed. But even when you look at consumers only, and in children, you're looking at milligrams of less than 50 in young children, about 75 in adolescents, and then it starts rising as you reach adulthood. And the highest group, just like Diane's data, is the 50 to 59-year-old group with a mean intake of a little over 200, as we would show in Haines' data. When you look at the 90th, we look at percentiles of intake, and just to orient you again, we're looking at the 10th, 25th, 75th, and 90th percentiles for each of these age groups. Even the 90th percentile of intake for young children is only about 50 milligrams, and just barely gets over 100 for adolescents. Now, your highest group is about 500, or I guess it's almost 500 for 50 to 59-year-olds on the 90th percentile, or 450 for 50 to 59-year-olds. This is the total population data. When you look at consumers only, now you've got those 4,000 subjects removed, and you can see that again, you see only minor changes in intakes for young children, and here's where you get the highest intake it goes a little bit over. It's 515 milligrams for the 90th percentile in the 50 to 59-year-old group. So that gives you kind of a look at what we would call the usual intake. Average intake is clearly age dependent, as Diane's data also indicated. About the average intake would be in consumers only would be about 36 milligrams in children 2 to 11, 72 in adolescents, and then the highest group is 257. The 90th percentile in children is 89 milligrams, adolescents 166, and then the highest age group is adults at 515. Now shifting to usual intake of caffeine per consumption event. I want to make sure you're thinking about this. So every time that you take a food or beverage that has caffeine in it, we counted that as an event. So that could be chocolate milk, could be coffee ice cream, could be coffee, could be an energy drink, could be cola. So that all of those events would be here. And this is, again, taking a usual, habitual intake perspective, adjusting these data with the National Cancer Institute method. So for young children, then, the average event, the average event would be about 18 milligrams or 15 milligrams per event. And you can see that mirrors total intake. So that's about a little over about 35 in adolescence, and then rises to about 70 to 80, depending on the particular age group that you're looking at. If you look at the 90th percentile of these consumption events, you can see that there really isn't a, again, you see the same kind of trend. It's lower in children. You basically, even at the 90th percentile, you're just about 25 milligrams per consumption event. And again, that rises with age until you get to about the older 50 to 59-year-olds, which gets you about 140 milligrams per event on a habitual estimate of consumption. Just to summarize those data, again, it's very age dependent. The total population average per consumption event is 65 milligrams. It's 15 in young children, 34 in adolescents, and the highest adult group is 84 milligrams per event. The 90th percentile data is 27, 59, and 137 for those age groups respectively. Now, trends in caffeine intake, and again, this is data from the single 24-hour recall that we've taken over time. We've actually put all 42,000 observations together and regress that over time and actually assess the regression coefficient to see whether there is a trend on intake or not. We've designated, so just to orient you, this is caffeine intake per day. These are actual data sets that were released in 2001, 2002 through 2009, 2010. These are actually flat lines for everything except children 2 to 11. And that regression coefficient is actually a negative 2 milligrams per data release. So for every 2 years, caffeine intake is actually reduced 2 milligrams per deciliter in those 2 to 11. I could have made that look better by changing the ordinance on this, but I wanted to keep all the ordinance the same so that you can see, if we plotted that at 0 to 50, you'd see a very steep drop in that particular chart. That's the only one on this chart that's statistically significant. So basically for these age groups, other than the 2 to 11, over the last decade, caffeine intake has remained relatively stable. If you look at the adults, the 35 to 39-year-old group actually has a statistically significant reduction of 19 milligrams per release cycle, and that's represented by this orange line here, whereas the other age groups have remained relatively constant, or there's no statistically significant change in intake across the last decade or so. So for this area, we would say basically intakes have not changed from 2001 to 2010. If anything, there's a small decrease in children 2 to 11 and in adults 35 to 49. And there's a regression coefficients of 2.5 and 19 milligrams per 2-year cycle, respectively. So if we look at, now we're going to look at trends in caffeine intake by food sources. And these analyses are done on the total population. So it kind of gives you a perspective. Again, I've kept my ordinance, the y-axis the same, so you can have some relativity as we go through the different age groups. But 2 to 11, you can see the major source is actually soda or carbonated soft drinks, and that has actually statistically decreased over time. The others have not changed. Now we do have very small N for energy drinks, like Diane said, and that'll be one of my limitations I'll talk about toward the end of the presentation. In 2 to 17, again, soda is the #1 source. That also is decreasing. The carbonated soft drink consumption has been decreasing. Thus, the caffeine from soda has also been decreasing. If you go to 18 to 35, soda again is decreasing. The major trend, I guess, with all the effort on public health associated with issues around carbonated soft drinks, those have been decreasing. This is the one group we can actually detect a statistically significant increase in energy drinks. It's a small but statistically significant increase, and again, if I change the ordinate, you'd be able to see that maybe a little bit more. And then in the 51-year-old group, even though they're our highest consumers, there's really no changes that have happened over time from these sources. Coffee remains by far the #1 source in adults. So just summarizing these data, soda is the largest source of caffeine in children 2 to 11 and in adolescents 12 to 17. In both those groups, contributions from soda has actually decreased over the last decade. Coffee is the largest source of caffeine in adults, not a big surprise for most of us that woke up with our coffee today. And energy drinks make a small contribution to all age groups. But we can detect that small, statistically significant increase, and it is only 1 milligram of caffeine per each 2-year cycle, so it is quite small. So my thought on this, on trends intake, if indeed our trends are stable, and we're decreasing in maybe 2 to 11, 35 to 50, 39-year-olds, and the marketplace is getting new sources, that suggests that there's actually trade-offs going on. Now, obviously, we don't have the data to be able to confirm that, and probably separate studies would need to be done. But it's hard to see that if we're not seeing a trend in anything increasing in caffeine intake and new sources in the marketplace, it seems logical that there's trade-offs going on. Now, with any study or analysis, there's strengths and limitations. The strengths of these data, it's a large nationally representative sample of children and adults. We've used sophisticated statistical techniques to estimate usual intake. For the purposes of this committee, you might have done the analysis differently, but that's how we were thinking about it. We did not adjust any of the data for body size, but we clearly could have, given we have measured body weights in NHANES, which would be a very big strength if that was going to be done. Now, some limitations. These data are self-report. Yes, we are using the best methods we know how, the multi-pass method developed by USDA. The first survey is done by in-person, which I think makes it a stronger piece of data. The second one is done 7 to 10 days later, or 3 to 10 days later via telephone. That difference in methodology is less of a concern when we do usual intake, because we're actually removing some of that variation through the methods that NCI has developed. And I have to also say these data are limited based on what's available within NHANES. Probably in 6 or 8 weeks we'll have 2011, 2012 data, but our data we can only measure up to 2010. And obviously, as was talked about earlier, there's been some radical or movement in the industry about putting other products in the marketplace with caffeine, which NHANES hasn't been able to catch up with as yet. And then the last limitation is small number of consumers for energy drinks for some age groups. And that's just depending on how you look at that, how you decide to break your age groups up, you may not have enough sample to be able to make a reasonable estimate. Thank you.